Hello, everybody. We are back again with another short episode, and this time we are going to talk about the field of oral medicines, to be specific about oral ulcers. And for that, we have a very good dear friend of ours, Dr. Shweta Hegde from Chhattisgarh in Bilaspur. She is the head of the Department of Oral Medicine and Radiology in Triveni Dental College in Bilaspur, Chhattisgarh. So, a warm welcome to you, Dr. Shweta.
Thank you, Dr. Amol. It's a pleasure to be on your show. Thank you.
Yes. So, about Dr. Shweta, she has got a rich 16 years of clinical experience in this particular field. And she's a specialist in diagnosing complex oral disorders. And she's also a leading advocate for the oral systemic link, which means the belief that your mouth is a mirror of your body's overall health. She's an expert clinician and mentor, and she focuses on early diagnosis and holistic care to bridge the gap between dental health and total body wellness. So, are you ready to field the questions, Dr. Shweta?
Yes, I am. Thank you.
Okay. So, the first question for your day are: okay, what causes mouth ulcers? Because as we all know with our clinical experience, mouth ulcers is a very common ailment that our patients come to us with. They can't enjoy their
Correct.
everyday food, it burns in the mouth, and basically it causes a lot of trouble in their everyday simple food habits. So I would like to know from you what exactly causes oral ulcers.
Yeah, so before I take that question forward, I'd like to just give a general understanding of what our mouth does for us.
Right.
The mouth or the oral cavity, as we call it, is essentially a very well equipped organ. And
Right.
this organ has its own, protective wall in the form of a lining, which is the inside of your cheek.
Right.
And then it also has its own cleaning system. It has saliva, which flushes out the bacteria as it enters.
Right.
And then it also has its own security system in terms of having a very good immunity, in place.
Absolutely.
So
Absolutely.
so whatever is entering the mouth, is taken care of usually by the system that is placed very well in the mouth itself. Now, if there is a certain change in this pattern, that's when you have what we call as a break in the continuity of a tissue, which is also called as an ulcer.
Right.
Now, the ulcer inside the mouth is called as an oral ulcer, and if it is forming on the skin, then it is called as a cutaneous ulcer.
Right.
Yeah. So the reasons for these ulcers to form, like you asked me, is first and foremost, it is, the food habits of the patient. Yeah.
Right.
And it could be some allergic reactions that happen, not necessarily in the order that I'm going to tell you. These are just some of the causes of the ulcer.
Common causes,
So,
right?
yeah, common causes. And the most common, actually, I must say, is what we call as a traumatic ulcer. That happens
Okay.
when the patient is just eating food, when they're consuming the food and they bite the inner surface of their cheek. That's called as a traumatic ulcer. And that same kind of ulcer can happen if the patient is wearing a brace, like a dental brace, orthodontic brace.
Right. Some
And
appliance. Yeah.
yes, some appliance. And if it's a geriatric patient or an old patient using denture,
Right.
right? Yeah. If the denture is worn out and if they haven't visited a dentist for a very long time, then maybe it's a good time to go check if there are any sharp edges that is causing an ulcer.
Right.
So trauma can happen in various ways from which an ulcer can occur. Other causes of ulcers are, nutritional deficiencies, as we
Right.
call.
Right.
Could
Right.
be,
Right.
yeah.
Vitamin
So it
or
could be
zinc or some
correct.
important minerals. Yes.
Yes, vitamins and minerals, like you said, vitamin B12 complex could be vitamins which are otherwise helping in, your everyday function. It could be minerals such as iron. It could be, also lack of folates, vitamin C. These are the things. If there is a nutritional compromise, then yes, there is a very good chance of a patient having an ulcer.
Great.
And to go further, sleep disturbance. As much
Okay.
as it's absolutely something that people take it for granted, but sleep disturbances causes stress, and that stress in turn will cause a lot of changes within the inside of your mouth, leading to ulcer. Yes.
How about indigestion and heartburn, acidity, and
Yes.
acid reflux? So certain people have that kind of problem too.
Absolutely. Yes, I agree with you. So patients who are having a lot of gastric reflux,
Right.
a lot of acidity, they have the sour, taste in their mouth,
Right.
it could be because of indigestion, it could be because of some other metabolic problems, like something which is related to digestion again, that could very well cause an ulcer. That is also one of the main causes for an ulcer. And also sometimes, we take for granted about the toothpaste.
Right.
The toothpaste so they have foaming agents in the toothpaste, the sodium lauryl sulfate that we call, and that causes a lot of irritation to the inner surface of your mouth, causing an ulcer as well. Yes, that is also one of the reasons.
So that is more like allergy to that particular ingredient in the toothpaste. Right.
Even food allergy causes ulcer. A lot of people have allergy to very commonly used food, like citrus fruits, strawberries, tomatoes, vinegar in the food. Any acidic food can cause an ulcer. It is basically causing a change within the inner surface of your mouth, causing ulcer. Yes.
Right. So basically, a lot of common causes. So identifying the particular cause in that particular for that particular patient is the key to the treatment, basically.
I agree.
There can't be one glove fits all kind of a medicine for ulcers. So right.
Absolutely.
We have a lot of these ulcers which recur, which occur more frequently again and again. You might have done your bit of medication from your end. It's gone for now, and probably in the next week or 10 days, it's back again. So what's your input on that front? Why does it recur frequently?
Yes, so these come under a category called as recurrent ulcers. As the name suggests, they're going to recur frequently. Some of the reasons that I just listed out as causes for ulcers could not have been, addressed, and that's why they're, recurring. That is one of the main reasons for ulcers to recur. Besides that, we have, viral lesions, viral ulcers because of viral infections such as herpes. Those ulcers also recur because if there has been a primary infection in childhood, that can recur later, again in adulthood and in the later stages of life whenever there is a trigger. So that ulcers also recur. So the ulcers recur primarily because the etiology hasn't been taken care of. The cause hasn't been taken care of.
Are there any triggers to these ulcers? I mean, you could be eating fine today and the same food habits you practiced yesterday, you're going to do it tomorrow. And in spite of that, you see that yesterday you didn't have an ulcer, today you are getting back that ulcer again. So what exactly would be the trigger for these ulcers to come back again?
Yeah, of course. There are a lot of triggers. One of the main triggers is stress.
Right.
Yes.
Nowadays, that's a very, very valid point.
Yeah. Absolutely. Yeah, and there is a stress which is not addressed, and it just compounds, and it causes a lot of changes within the oral mucosa as well, as much as it causes mood swings and things like that. But within the oral cavity, it's one of the ways in which your oral cavity or the mouth is filing a complaint to you, and it's telling you that I am stressed. You need to take care of me. So stress is a big problem, and stress releases cortisol, and that causes a lot of inflammation within the inside of the mouth, which eventually makes a break on the tissue and causes an ulcer. So one of the main triggers is stress, and then you have hormonal triggers. Female hormones, especially during the menstrual cycle. There could be either a lack, or there could be some fluctuation or drop in female hormones such as estrogen and progesterone. These definitely cause ulcers. They are one of the triggers for causing ulcers. And then, like you said, the food habits, and also certain allergens in the food. That's another trigger for causing ulcer. Lack of sleep, that's also.
That's another valid point nowadays.
Yeah, yes. It keeps going cyclically. Patient loses sleep because of stress. That adds to, not having good nutrition. Patient doesn't want to eat well for whatever reason. And that nutritional deficiency in turn will make sure that the oral tissues are not getting the amount of nutrition that they need, and then they break out into an ulcer. And that goes cyclically, and you have to identify the cause. So if you're having recurrent ulcers or you're having triggers with ulcer, I suggest that they definitely visit their dentist, and they have to admit that these are the things that's happening, and maybe the dentist can help them out accordingly. Yes.
Now, I'm talking from my own personal clinical experience. I've had patients in the past who have come and saying that, what, doc, there's an ulcer, and it's been around for quite some time. It's just not going off. Is it cancerous in nature? Should I go and do a biopsy? And so my question to you is, how do you differentiate a normal ulcer from a cancerous lesion? So that is something which a lot of paranoid patients come in with. So what's your?
I agree. So a regular ulcer, which we call as an aphthous ulcer. Or something that will, it will heal within a few days, within 7 to 10 days max. Okay. And if an ulcer is persistent, an ulcer is persistent beyond 2 to 3 weeks, that should definitely raise an alarm, and they should go visit their dentist and get themselves examined, unless it's a traumatic ulcer and the cause of trauma is still inside in the mouth, it's lingering, and it's obviously going to cause, frequent ulcerations. But if it's not a traumatic ulcer, then the doctor will examine your oral cavity, and he or she will be able to identify the exact reason or the nature of the ulcer, because the ulcers which look cancerous, they appear very differently than your regular ulcers. Okay, so there are there are ways to identify these cancerous ulcers, and your doctor will very well be able to do it. So it's a good idea to visit your dentist if there is a lingering ulcer beyond 2 to 3 weeks.
Nowadays, you even get these home cancer testing things. We have seen these ads. So a lot of these patients try to the so-called DIY kind of a technique, try to test themselves whether it's a cancerous one or no, So, but like you said rightly, the best way forward is to first go to your dentist, and your dentist is the best possible person who can lead you in the right direction. If it is required, yes, histopathology and biopsy and everything else can be followed up with. A lot of patients ask is it contagious? Is it going to spread by something as simple as by kissing or something, So it kind of cracks me up a little bit, but, if our audience can get to know about whether they are contagious or no. So again, your input on that, please.
Yes. Not all ulcers are contagious, but ulcers are contagious. Some of them
Okay.
are. So
Okay.
you may not be able to identify, the patient themselves may not be able to identify which ulcers are contagious and which are not. For example, the aphthous ulcer or the canker sores that we call, which happens because of, simple reasons like a nutritional deficiency and things like that. Those are not essentially contagious,
Right.
right? And they heal by themselves, they heal within a few days, and they're absolutely great. But the ulcers that occur because of viral infections, like a herpes infection, those are
Hmm.
absolutely contagious. Now, since
Yes.
the patient will not be able to understand which
Make
ulcer
out
is,
exactly.
yeah, contagious and not, it's a good idea not to indulge in kissing if they ever have an ulcer in the mouth, and it's good to just wait for a while, because these the ulcers which have virus in them are, they're very much transmissible, because
Absolutely.
saliva is a good medium, and
Absolutely.
they are contagious. Yes.
Finally, moving on to the last question, treatment. How do you treat these ulcers? Definitely, it's going to be dependent upon the kind and type of ulcer. So, just a brief explanation on that front about the treatment.
So the ulcers are treated according to the causes, right? So not all ulcers can be treated the same way. So that's the reason I suggest that any patient having an ulcer should not waste time self-medicating. They should
Right.
definitely visit their dentist, because some ulcers, when the doctors identifies it, it's as simple as giving them a nutritional supplement, you
Right.
know so the nutritional supplement will take care of their nutritional deficiencies, and thereby it's a cure in itself, it's a treatment in itself. The other ways of it is by giving an anti-inflammatory or an analgesic medicament, for application. The patient will be asked to apply, the doctor will prescribe these medications for you. And of course, if it is viral lesions, then the doctor will have to look into it further and confirm viral infections, and then give an antiviral medication. And of course, if it is cancer, and then we'll have to probe into it further.
Exactly. There will be a
You
different
have to
line
go
of
into the
treatment altogether.
investigations.
Yeah. All
Yes,
right.
yes.
Right. And
But
definitely there
for,
will be. Yes. Go
sorry.
ahead, please. Go ahead, please.
Yeah, so the one of the good things that you do when you have ulceration is, because one of the reasons for ulcers is also dehydration states. We did
Okay.
discuss that, when patients are having gastric reflux and things like that, so they also have dehydration states. So a good way to treat them inside within their confines of their home is to drink plenty of water. That
Right.
helps. Or chewing on ice chips, ice cubes, so
Right.
that will relieve the pain and also give them certain amount of hydration to the mouth. These are simple ways
Ice
that
itself is
they can.
it's a numbing agent, so it kind of
Absolutely.
numbs that particular area, and once it's numb, definitely your pain quotient is going to
Yes.
go down. Absolutely.
Yes. Yes.
Wonderful. Thanks a lot, Dr. Shweta. I
Yeah.
think our audience is going to get massively benefited with all your inputs. We will be back again with you with another interesting topic. Thank you once again.
Sure. Thank you so much for this opportunity. I really had a great time,
Pleasure having
giving
you
my
here.
2 cents on this topic. Yes. Thank you so much.
Thank
Thank
you.
you for having me.